Hello, Dr. Hall here again, Los Angeles, California, with Upper Cervical Healthcare Clinics office in Los Angeles and Carson. Today, the subject we want to talk about is post-concussion syndrome. Post-concussion syndrome is a topic that's actually gotten quite a bit of press as of late. For those of you who follow the NFL, you know that the Players Union has been in conflict with NFL owners because of the fallout of many retired NFL football players either committing suicide or suffering with long-term post-concussion type syndrome symptoms. So what I want to talk about is how do sports injuries relate to post-concussion syndrome? How do the injuries that cause a concussion relate to the upper cervical spine, and what is the missing link in the post-concussion syndrome debate? So we all know when someone suffers a concussion, there's a fast deceleration of the head, whether that is an impact into the ground, whether it's another football helmet careening into someone, or it's something like you dive off the diving board and you misjudge the bottom of the pool and you hit your head rather hard on the pool bottom. So when someone has a concussion, that jostling of the brain slamming up against the cranium, actually injures the brain tissue. That's well documented. We know that that causes cognitive problems, depression, and a whole other host of concussion type symptoms. But what's misunderstood and not well represented out there in the public when it comes to post-concussion syndrome is why do these people who have a concussion sometimes 3, 4, 5, 10 years later continue to suffer with severe cognitive deficits, depression, the inability to carry on life, low energy, neck pain, sinus problems. I mean, there's a whole host of post-concussion symptoms that in a large percentage of these people never leave them. And it's got to be something beyond just the concussion. And so, because I'm an upper cervical chiropractor, we specialize in the upper cervical spine, and we've seen probably 50 post-concussion syndrome cases over the years. And what we find is if you had an injury that was strong enough to slam your head up against your cranium, it was also strong enough to cause the first vertebra in your neck, which is called the atlas. That's this guy. There's 2 little joints on the top of it, and there's also 2 on the bottom of the head, right here and right here. And the head basically articulates or fits here on those 2 joints. So because the head weighs 10 to 12 pounds and the atlas weighs 2 ounces, when you've sustained an injury big enough to cause a concussion, simultaneously you have an atlas that becomes dislodged and locked under the skull. It actually tears the ligament, it tears the soft tissue, and becomes stuck under the head. Why is that important? Your brainstem passes right down through that hole. And if the vertebra has shifted and it's become locked under the skull, all of a sudden now you have mechanical traction on the spinal cord, and now you've got a cascade of irritation and interference to central nervous system function that, if that vertebra isn't corrected, stays there. Your body will adapt the best that it can. Some people that have concussions, they adapt. They then don't have this problem corrected, but their body has enough adaptive capabilities to deal with it. And yet, there's other people where that vertebra is so far out of position, it's impacting the central nervous system, and the body's not able to adapt. And when the body's not able to adapt, you set the stage for chronic health problems. So, in our offices, what we do is we take precise x-rays of how those 2 joints fit to the bottom of the head. We want to know in millimeters, how are you out of position? How are your joints angulated? Everybody's anatomy is different. And once we determine exactly how you're out of position, we make a very precise, soft, gentle, quick correction to take that vertebra that's locked out of position under the skull and get it back under the body's control. Once that's done, pressure is removed off the spinal cord, and over time, the body can start to go through a healing and repair process. So one of my favorite quotes, kind of to encapsulate that upper cervical message and relating it to post-concussion syndrome, is nature needs no help, just no interference. So our one big thing we do in our office, regardless of whether you have post-concussion syndrome, migraines, insomnia. Our job is to get rid of the block, get rid of the interference on the central nervous system, and allow the body to go through and heal and repair to the best of its ability. I hope that anyone who's been suffering from post-concussion syndrome, or are they under any other chronic disease process, that this video has made sense to you. I can tell you it changed my whole life 23 years ago, and our office is dedicated to the people that are out there that are suffering, that have been to 30 and 50 and 100 doctors and haven't found a solution. So if you're outside of the Los Angeles area, look up upper cervical chiropractor in your area and get to someone who specializes in correcting the structural problem at the base of the skull. No popping, no twisting, no yanking on your neck. It's very precise, it's gentle. All right, till next time, have a good one.